Well, I don't think it's rocket science. I think the research we've done shows that really it's the importance of place. Basically, it defines us, it defines our relationships with each other, with our work, and with the communities that basically we come together to create. So I think what shows us is that all the organisations and people working in those areas have a much greater understanding of the rhythms of the place, of their needs, of the needs of the community service areas, that actually if we could pull that together in a much more sort of organised, maybe systematic way, the whole reservoir of knowledge and information we've got there we can actually look at together across the piece and work out how best to organise in those places. Now obviously we've done a lot of work with charities, with social enterprises, and then with other voluntary and community organisations, and essentially they are vital in this work, because essentially they are at the coalface, if you like, with our communities definitely dealing with issues of need and of complexity, some of the most sort of complex needs in the country. So I think it's really important if we could actually sort of sit around the table across the social sector with our community groups, with our voluntary groups, to basically say, okay, how can we work together better? How can we organise ourselves better around the places where we live to actually ensure that we can provide the best offer both to the people that we're dealing with and also to the public service providers that we work with every day, to ensure that no one gets left behind, to ensure we maximise all that social impact we're looking at, and to ensure basically that the services and the lives that our fellow citizens live in the places where we live are as best as they can be. The main challenge is obviously money. I mean, the financial situation and our ability to cope with it and overcome it is one of the main reasons I think that place-based approaches are rapidly going up the policy agenda. So rising demand, rising need. Now, there are also things that make it much more difficult to actually bring off because there is no money. And devolving these issues down locally to partnerships of public service organisations and sort of social sector organisations means they might be overwhelmed by this. So I think we really need to move quite quickly, but at the same time be very clever in how we do this by working together and forming those relationships. That leads on to the second potential pitfall. In some places, levels of relationships are not exactly, shall we say, optimum. So it's a case of actually, are we expecting some places in the country to be able to run before they even can walk or skip? I think one of the other areas I think is really interesting though, and this is more of a political, this is a conceptual issue. What does it say for that local accountability is the very notion of a local area, actually, if we're thinking of new models of interaction of how to work with each other? It's quite obvious. Normally you've got your local authority, you've got your NHS bodies, you've got the people, you've got your charities sort of as a buffer in between those social organisations, and obviously you've got your local shops, your local businesses. I think I'm beginning to think we need to press the reset button completely on this one and do some radical thinking about how we organise our places, what new models are out there for a proper Big Bang theory about how we organise our places. And that's got a lot of connotations. It means that the councillors in your area might no longer be right at the top of that pecking order, but it also means that lots of charities, social enterprises have to take much more responsibility for the area they're in, and they can't just have a relationship where sometimes they will complain about the public service contracts they've got, because they're actually more intimately involved in actually setting the agenda and setting the strategy. And obviously both of them have to get on board in a much more meaningful sense, I think, with local businesses, because only with those three sort of legs of that stool, local public services, local businesses, and crucially local social sector organisations, do I think that we're going to overcome the challenges that some of us are worried face us over the next 10 years.
We're aware of lots of outsourced big contracts that have gone wrong, but specifically within the children's sector, there are children's organisations that have been brought completely down by having several big contracts to run that are utterly unsustainable. So the one or two that everybody knows about, one of those is For Children, which has closed now because it was delivering lots of government contracts. We would say that obviously by the time the contract fails, that's too late for children and families relying on those services. By the time the organisation fails, that's obviously far too late for all their service users. The main impact is on those children and families themselves, who have massive uncertainty when their service, well, they don't know what's going to happen to it. The service ultimately might continue, but what they hear first is that it might not continue and the door's closed when they turn up to get their service. It might continue but being provided by a different organisation, and look, quite different from the service that they were used to, which obviously isn't going to be good. In the children's sector, other charities are very good at trying to be ready to sort of pick up the pieces of those services. And obviously people try to turn that around very quickly, and I would say in the children's sector that has generally happened quite well, and so there hasn't been too much sort of chaos between one service, closing and another one opening. But as you see with huge scale contracting, there becomes a sort of homogeneity of delivery, where big organisations, they're the only ones big enough to win those big contracts. And so what they deliver in one area that might have been appropriate when they bid for that service in that area becomes very similar to what they're going to bid for in another area, because it's so resource intensive to bid for those huge contracts. And so services become more homogenised, and one big organisation running their various services is running very similar services where that may not be appropriate. So the impact of a service closing on the people using it might be that the people coming along to deliver the next service might do something very different, which may or may not be appropriate for their needs. I think it's always been really worrying for local government, particularly in the children's sector. One of the few areas where local government has a statutory responsibility is in children's social care. It's one of the areas where they've tried not to cut their budgets because they've got statutory responsibilities, especially as corporate parents to children in care. So the children's residential sector, for example, has long been that mixed market of independent, private, voluntary and public sector providers of homes for children. And where there are large contracts there, I think the local authority is keenly aware that those are quite risky. Central government, I think, has been fairly blind to it for quite a long time, and I would say since Carillion and since investigations into collapses like that by the Public Accounts Committee and National Audit Office, central government must be aware of it. I don't think the tide has completely turned on outsourcing. I think we're seeing examples of local authorities starting to do it very differently, which is great. But, for example, in children's residential care, the issue isn't just with what types of contract you think you're going to issue. Lots of local authorities know that they don't really want to issue huge contracts, and with children's residential care, the contracts themselves are not necessarily huge. They are for 10 or 20 beds for children who are really, really vulnerable, and the local authority is constrained not by the size of that contract, which might look quite small, but by the way they purchase the beds for those children. So they might purchase 5 beds over 5 weeks, and it's such an urgent choice, they can't choose which provider they're going to go with other than the cost and the availability. That's a huge problem. Children might end up in a home provided by a huge company that isn't really interested in those children's needs. The local authority can't do much about that because that company was the one that said, yes, we've got beds available within the next week for that child who desperately needs it. So whilst local authorities might want to turn the tide on that kind of purchasing system, there's not much they can do about it without central government being behind that. So that, for the foreseeable, will continue, and a relatively small number of children might end up living in homes that are not suitable for them because they are run by the wrong provider. The civil society strategy last week, I think, rhetorically gives us reason to hope that these public service markets will change. That's what the government says it wants to do. It remains to be seen whether we'll get enough system change for things to actually change.